Welcome back to Scrubton. Today we will be discussing a very important but often confusing anatomical structure, the clavipectoral fascia. This topic is high yield for MBBS exams, clinical anatomy, and even surgical relevance. So make sure to watch till the end. So what is a fascia? A fascia is a connective tissue that surrounds muscles, vessels, and nerves. So today we are going to discuss about clavipectoral fascia. So clavipectoral fascia, it's a strong facial sheet deep to the clavicular head of pectoralis major muscle, and it fills space between clavicle and pectoralis minor muscle. So in this picture we'll study about the clavipectoral fascia. So this is the clavipectoral fascia. Then it is deep to the clavicular head of pectoralis major muscle. So it is deep to the pectoralis major muscle. Then it fills the space between, this is the clavicle and this is the pectoralis minor muscle. So this fills the gap between these both structures. Now we'll come to extent of the clavipectoral fascia. So from vertical direction, when we look, the clavipectoral fascia is divided into two lamina in the upper part, which encloses the subclavius muscle. So it divides into two parts. Now this clavipectoral fascia, when it is split into two parts, it has an anterior lamina and a posterior lamina. This goes up, posterior lamina goes up and continues with the investing layer of deep cervical fascia, and the anterior part of the lamina goes and attaches to the clavicle. Now in the lower part, the vertical dimension, the clavipectoral fascia now goes downwards, splits and encloses the pectoralis minor muscle. Below, then it again extends. After splitting and closing the pectoralis minor muscle, it again extends as the suspensory ligament. This suspensory ligament is required for the maintenance of dome shape of the axillary fascia. Now the medial part of the medial extent of the clavipectoral fascia. Medially, it attaches to the first rib. This is the first rib, and costoclavicular ligament. This is the medial side, and this is the lateral side. So laterally, it extends from the coracoid process. This is the coracoid process, coracoclavicular ligament, and there is costocoracoid ligament, that is from the thicker upper part of the fascia from the first rib, this is the first rib, till the coracoid process. This area is the costocoracoid ligament. So costocoracoid ligament, costoclavicular ligament on the medial side, coracoclavicular ligament on the lateral side. So these are the extent of the clavipectoral fascia. Now we'll go on to structures passing through the clavipectoral fascia. This is the exam favorite question. Actually the structures that are passing through the clavipectoral fascias are mainly four structures. We can remember by a mnemonic called CAL. So what does CAL stands for? C stands for cephalic vein. A stands for acromiothoracic artery, that is thoracoacromial artery. Then L stands for lymphatics, and the other L stands for lateral pectoral nerve. Okay, so now we'll study from which branches these structures are rising. So the cephalic vein comes from axillary vein. The thoracoacromial artery is a branch of axillary artery, and lateral pectoral nerve comes from the lateral cord of brachial plexus. So these are the structures passing through the clavipectoral fascia. Now, what is the importance of clavipectoral fascia? This is the clinical relevance or applied importance. So why do we care about the clavipectoral fascia? It acts as a protective barrier between the superficial and deep structures of axilla. That is one point. Next, then it also provides an important pathway of neuro and vascular structures. Then it is also important in breast surgery and axillary clearance. So the knowledge of fascia is very crucial in these situations. And the suspensory ligament, that is this, helps in maintaining the concavity of axillary fascia. So that's it for today. That's all about clavipectoral fascia. If the video helped you, don't forget to like, share and subscribe to reach more medicos like you. Drop your doubts in the comments and I'll be happy to answer. See you in the next session.